Hello, everyone. It's your man, Stan the Man Martin. Welcome to Reach Radio, Racial and Ethnic Approaches Towards Community Health. I'm your host, Stan the Man Martin. I'm joined here by my esteemed colleague, Ms. Ebony White. Ebony, how are you doing?
I am well. Hi, Stan. How are you doing?
I'm doing well. I'm blessed and highly favored. It's good to be back in this space again with you. A lot has happened since we, last talked. We had a chance to get together. But for our audience who might be joining us from the East Coast, from the West Coast, or from across the world, for those who might not be familiar, we just want to just share with you some information. If this is your first time joining us, just a little bit about Reach and who we are and what we're all about. So, REACH stands for Racial and Ethnic Approaches Towards Community Health, and we're working here in Buffalo, New York, in what we call a unique space called the Ferry Corridor. Where so our goal is to address and reduce chronic disease among African Americans and those with some of the highest disparities when it comes to life expectancy and other related illnesses. So, and also we want to promote the many assets that our community has to really promote health and wellness in our community. So we're focusing on increasing access to food and nutrition, improving community linkages to services, as well as diabetes management and programming. In addition to that, we're also focused on reducing the disparities of tobacco, the harmful effects of tobacco use, as well as when you think about this time and space that we're in today, and increasing awareness and education surrounding COVID vaccination. That has hit the African American community and Black and Brown communities the hardest. All right. So those are just some of the things that we're focusing on and working on, Ebony and I. And Ebony, before we go any further, you want to take a few minutes to introduce yourself and our guests, and then we'll move forward from there.
Awesome. Thank you. It's been so long. It feels like so long since I've been with you all. But again, I'm Ebony White. I am the Community Outreach Coordinator with Buffalo Center for Health Equity in Reach Buffalo. So you've probably seen me in the community. If you have not, you will. So we have some great plans ahead of us this season. And I look forward to being with you and serving you all.
Absolutely. Thank you. Thank you. And we have an esteemed guest with us as well. Ebony, look, full disclosure, we have Latrice Martin, my sister, who I'm very proud of, in this space today. But, Ebony, I'm a little biased. Why don't you go ahead and, just go ahead and spill the tea and have a little conversation. And I'm going to sit back for a little bit, okay?
Okay, that's awesome. So today, as always, we are always excited to bring to you some of our trailblazers in our very own community and respective spaces that are actually working cohesively, well woven in much of our work that we do right here with Reach Buffalo. So I'm going to introduce to you all Miss Latrice Martin. Hi, Latrice.
Hi, how are you today?
I'm good. So I'm going to ask, same things. Let the people know. Tell us a little about yourself, where you're from, and I really want to hear about Kidz Zone. As always, all of our viewers, I ask that you get your pen and paper handy to take notes. Kidz Zone, tell us about that.
Okay, well, first of all, my name is Latrice Martin. I am the director of Kidz Zone Child Care Center. I've been working here for 25 plus years, and children is my world. I absolutely love children. I love to help them. I love to see their progress of how they started and how they end when they have to get older, when they go out my doors. We're located at 2680 Main Street, right across from the Amherst train station.
You know what? I love that. So everyone, did you hear what I heard? Longevity. So there are people walking around about 30 years old, 25 to 30, that Miss Latrice has had a hand in developing from the very early stages. Yo, that's phenomenal. I like longevity. So could you tell us some of the eligibility requirements for Kidz Zone and the ages and for enrollment in services?
Well, we service children from 6 weeks to 13 years of age. We are open Monday through Friday from 6:30 in the morning to 6 p.m. And basically, if you have a job, if you're looking for a job, if you are in college, far as in a training program, if you're in high school, you can go downtown to the Department of Social Services. You can apply. We are also partners with CAO. So our infant and toddler program actually has the CAO, which is really great. And they help you. We help also meet like all the milestones of all of our children, just make sure that they are progressing how they should on task. And we have our before and after school children that comes in the morning time. They have breakfast with us. They come back after school. We assist them with their homework. And then basically, I mean, you can't lose. So if you have low income, you have high income, we take private pay, DSS, and WDI, I'm sorry, the workforce development. And we also have Department of Social Services in private pay, if I didn't mention that.
Correct. Listen, the village, right? So we all know it takes a village to raise our children.
Absolutely.
And she's really demonstrated like there's really no excuse, right?
None.
We all have some things that some obstacles and barriers. However, if you're looking for work, if you're people actually having support while you're looking. Often, people just think once I get a job, then I'm looking. But this is so proactive that while you're in high pursuit, because looking for work is a full-time job, actually, that you have someone, a safe place, a safe environment for your children, where they're getting their educational lessons and being supervised and really molded. Wow, that's good. So when COVID started, when the pandemic kicked off, what were your initial thoughts? I mean, as just a person of great heart and compassion for people,
I
particularly
was
our little people.
I was nervous. I was completely nervous. What are we gonna do? Are we gonna have to close? And we didn't have to close because they considered us essential. We have not closed at all by the grace of God. And I logged on every meeting that came apart. OCFS, the governor, the doctors, everything. My goal was to get as much information to keep myself informed so I know how to move forward. The ultimate goal was not to just keep myself safe, but to still provide service and to provide quality service, to provide healthy service. So I logged on, I stayed a part of the meetings. We had numerous staff meetings about what was going to take place for changes, and one step at a time.
Yeah. Ebony, thank you for that question, and Therese, thank you for for leaning into it. As I mentioned earlier, we're looking at addressing vaccine hesitancy, especially in our community, and there's an African saying that says, how are the children? Are the children well? So it's very important that we as a village that we're always, as Ebony mentioned, creating that safe environment, for our children, for our families, and especially those with some of the greatest needs, which it sounds like, that's your priority focus, or some of your clientele. I was just wondering, can you share with us, if you don't mind, has COVID impacted not just your business, but the people who you're serving? Some of your experiences in that area.
So let me back up a little bit. When COVID did happen and they were talking about getting vaccinated, I was the first one. Nope, I'm not doing it. I'm not getting vaccinated. Absolutely not. I don't like needles. I don't care what it is. I'm just opting out. But as I uh, received information and took notes, that's when I actually changed my mind. Far as this is not as bad, and this is something that I needed to do. Um, it did impact us. It impacted our business, and it impacted our personal life. I was, like I said, I was 100% nervous when I went and got my vaccine. I was like standing in line, and now I'm like, okay, I'm about to go because my anxiety started hitting it. And I just told them, like, I'm nervous. I don't do needles. And I sat there and I'm like, here go my arm. Just talk to me, do what you got to do. And I was 100% fine. I was tired after I received my shot, but I didn't have any symptoms other than that. And I was happy that I did it. And as I did it, it was my job to inform the rest of my staff. My staff looks up to me. So I told them the pros and cons of getting the shot, the pros and cons to getting vaccinated. And I was like, this is the one I got. This is the reason why I got it. And they trusted me. I signed all my staff up and I took them in groups to get their vaccination. And we talked about not just us as an individual, but I talked to them about keeping their household safe and then also keeping our children safe. We do service a lot of low income families. So even with that, they don't have the information, they don't have the needs, the materials that also sometimes keep themselves safe. So that's something else that we had to, get in place, and even down to wearing the mask. Okay, I went and got masks. Here you go, and I'm passing out masks until we can get a hold of it, and everything I can sign on to get to help my staff and to help us be able to operate. That's exactly what I did.
Wow, Latrice. I mean, you my sister, so it's like hearing you, share that experience, how it impacted you, and then also, having the empathy, to reach out and help others, is really awesome. Oftentimes when Ebony and I we're working in the space, we hear. A lot of people feel that way in terms of, their anxiety when it comes to needles or, having misinformation, and, you being willing to roll up your sleeve, do your homework, do your research, to make an informed decision. What I heard you say, not only for yourself, but for your family, and for your community, so, that's really, that's a champion, as we say. That's an ambassador, for creating, health and wellness in our community. Sound like you were about to say something. I didn't want to interrupt you.
Well, even with that, I did get my children vaccinated. I have 3 children of my own, 13, 7, and 8. And I had my children go get vaccinated. They were, it was a show. I'm not going to lie. It was definitely a sight to see. And I'm very particular. So even with that, I didn't want to necessarily go to a pop-up clinic just because I knew how I was. Like I said, I know how my anxiety is and everything. So I'm like, okay, no, we're going to their actual doctor's office because I have a relationship with them. I felt comfortable with them. And I told my children, they're like, Mom, I don't want to get it. I don't want to get it. And I'm like, some things you can make a decision on and some things you can't. And I explained to them that this is a decision that they cannot have, a choice that I have to step up and be the mom, and you don't have a decision. And I explained to them, far as with them being out in the community, how COVID has no particular person, no age or anything. And it's my job as their mom to keep them safe. And I will feel less of a mom if I knew that I had the ability to get them vaccinated and I chose not to get them vaccinated. And God forbid something happened to them where they could not fight COVID in a proper way. I wouldn't be able to live with myself. So I explained that to them. Also, we're very active. We play flag football, we play regular football, basketball. My daughter takes dance, and they were still wanting to participate in those things. So these are, if you want to do this, you have to do this, and this. So that's how I also handle it. And like I said, it was very hard. That first shot was the worst. But when they went in to go get the second one, we all of us took it like champs. So we were good.
Well, I applaud you, and my nephews and nieces, for taking that, that first step. You said a lot. You talked about trust. You talked about doing your own research. In your opinion, if you were speaking to someone who were hesitant, how can we reach hesitant about getting vaccinated? In your opinion, how could we reach someone who's hesitant about getting vaccinated? or those who
So
aren't
personally,
vaccinated?
what I did is I gave out the knowledge that I had of what I received from being on different meetings, talking to the doctors. And then I also told them, don't just go by what I say, look it up for your own self. And just explain to them how, you everyone say, oh, I'm tired of the mask, or I'm tired of this, I'm tired of COVID. Right. But if you are tired, do your part to make sure you're okay. And it's okay to be nervous, it's okay to be scared, but it's not going anywhere. This is what it is, and we have to figure out what we can do on our end to personally handle it. And I would definitely recommend for them to even consult with their own doctor. First you get your information, listen to what I'm saying, look up on the information, talk to your doctor, take notes, and move forward. And just tell them, like, you want to travel, you want to go out in the community, and you have to also still be mindful of where you go. You don't know when that place was sanitized last. You don't know who came in before you that was sick, that's not vaccinated, and or they are vaccinated and they may or may not know. So it's everybody, you don't want to, it's almost like everybody is unsafe, so you don't know about this person, you don't know about that person, and you have to think it's a ripple effect, and it's not something that's done purposely, but some people don't know that they're walking around with COVID, and you're put in harm's way, because you were in their surroundings. So at least if you're in their surroundings, you know that if you're vaccinated, you're covered, where you may not have any symptoms, or your symptoms may be slim to none, but also you can still feel a little more comfortable when you're moving around throughout the community on a day-to-day basis.
Great, 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 great. Appreciate that. You mentioned, about not knowing, and Ebony and I, we talk about, it's not like you have a sign on your head saying vaccinated or unvaccinated, or, what have you. And there's been a lot of, information or uncertainty from the CDC as well, just being transparent and honest about masking. You know, what has been your experience with working with children, working with parents about masking and schools, and if you could talk a little bit about that.
Well, me personally, I think it was a horrible idea to unmask because COVID is still here. For our center, we are still wearing masks. My staff still wear masks. Our children from ages 2 and up still wear masks. If they choose not to wear it in school, that's fine. But when they walk through these doors, I have a mask. You're putting your mask on. And you have to take it one step at a time. And toddlers, they're sneezing, they're coughing. You can't predict when they're going to sneeze or cough in your face. So we have to protect ourselves, and that's where our staff get into wearing their mask, and even the children still wearing those. We still ask parents if their child is sick to please keep them home, but they're like, oh, it's sinuses, it's this and that and the other, and sometimes it is and sometimes it's not. You never know. Our 3 and 4 year olds, they wear their masks all day. And the school agers, you have to think they're on a school bus or they're on a metro bus. They're in school around all these children, and then they come here. So they're around so many different people. It's hard to really dissect if they was to get something where it came from, but you have to think they're around so many different people. I think it's a wise idea to continue to wear the mask. Um, Even out and about. When I go to the store, I'm still wearing my mask. I don't know you. I don't know not stating that you have something, but I don't know what you have, and I don't know what you don't have, and I don't want you to put me in a situation for me to find out. So I put my mask on. I like it now, especially when it's cold outside. It just help keep your face warm.
There's benefits, right?
Yeah. So
Absolutely, absolutely, absolutely. I want to bring my friend and colleague Ebony into the conversation to see, Ebony, if you had any thoughts or questions that you wanted to lean into with Latrice.
You know what? I appreciate your candidness. So even despite you being siblings, you still was like, okay, Stan, you got some information, but you still went out further to gather and all of the information to keep everyone at your business abreast, right, of next steps and how to protect themselves. So Everyone still has to continue to wear masks at this time as they, in and out of your business, including the employees. That's something for our viewers. That's something to know. I appreciate your leadership saying not yet, even though with all of the policy changes, removing it, you made an executive decision with the greater good for everyone to say, listen, we're going to keep doing this and I'll keep an eye out. And I have all of the resources to kind of keep everyone current. So because you're doing phenomenal work with children, I just think it's amazing because you don't look more than 25.
Thank you.
That there are folks walking around that you were possibly changing their diapers.
Yeah.
Tell us, how can people find out more about your organization?
I don't have a website yet, so
Okay.
soon to come. But if you would like to give us a call, I am always here. You can call in for information, or if you want to stop by to get information, you are more than welcome to stop by. Like I said, we are open from 6:30 a.m. to 6 p.m. Monday through Friday. You are free to come in to get information. I can set up a tour. You do have to have an appointment time to actually come in and set up the tour, and you do have to wear a mask. We are still wearing masks. We still doing temperature checks and asking COVID questions.
Okay. Is there anything that we did not cover that you want to share, whether it's pertaining to Kidz Zone or COVID or any other passions in your life outside of the children, which that's a great
No,
passion.
I think that's pretty much it. During COVID, like I said, we closed down. We received our first case of COVID 1 year after COVID started, and
Wow.
I was hurt because I'm like, why me? But then when I called to report it in, they like, that's great. And
One
we had a
year.
house full. Yes, 1 year. It was a little over a year after COVID started. We had a house full. We were doing virtual learning for our Buffalo Public School children. So we were here. Not, I mean, we were safe. We had fun. They was doing their education still. I mean, we were doing it, and it wasn't an easy job, but we made it. Um, I believe in hard work. I'm a fighter. Sometimes you get frustrated or you try to figure it out, but you got to take a step back to take 5 steps forward sometimes. So, and you have to, patience is everything as well. So, I couldn't beat myself up over it anymore. It is what it is. It wasn't anything I can do to prevent it. And when I even talked to our staff, it was like, hey, we were cleaning, we were sanitizing. It was, I don't want to say our time, but it was like, this is our time. But over a year
Wow.
later, after COVID started, is amazing.
You see, I had to lean all the way in.
Yeah.
So for anyone that is operating a business, whether it's a daycare, we need to take a peek at Latrice's operation for day to day. So whether it's, your cleaning, your products, to go a full year until over a year before you had one case. That's really pretty much been unheard of. Latrice has a tight ship over there. We need to look at that operations and that scheduled time for cleaning and processes, because that's huge. And you were feeling bad about yourself. Stan, make Latrice an award.
That's right.
I was,
That's right.
because I'm like, oh my God, and I'm checking on my staff, I'm checking on kids, and I'm like, what could I have done differently? And I was just checking on stuff, like we were doing this, we did that, and it's like I did everything, so I can't beat myself up. And even when I talked to our licensor from Children and Family Services, she was like, Latrice, is centers that's closing every other week and everything. So she was like, you're doing great. I mean, we were full house. I had what, maybe about 17, 18 staff, and we are licensed for 79 kids. So we were full doing it. So, I mean,
Wow.
God is good, and I'm grateful. I'm very grateful.
That's amazing. That is amazing. And on behalf of Reach Buffalo and working with Community Health Center of Buffalo, I want to be able to provide you with some at-home kits for your staff in the families that you serve. So I will get those to you because that's tremendous.
Yes.
Being able to, really, you kept everybody safe. Everybody. Stan, I know you are extremely proud.
I'm very proud, of my sister. She's doing phenomenal work, for this community, and I want to encourage the community to support, our minority women and Black-owned enterprises, our businesses. Many hands make light work, and just for Latrice and also the community as a whole. Ebony and I, we're going to be working to bring some trainings to the community surrounding how do you have these conversations with family members, with friends, with those who are, in your circle in a real informal way surrounding, COVID, vaccination. We, like Latrice said, we want to meet people where they're at, and also provide them with resources and information so that they can make a informed decision, for themselves. So we're going to be, having trainings for businesses, Latrice, for your staff. We certainly, Latrice is already one of our community champions. She don't know it yet, but she's already on the docket, for that. Just hearing her testimony and her story. So we want to thank you all for joining us. For this time, for this conversation. So we greatly appreciate that. And once again, Latrice, how can they tell our audience, how can they get in contact with you again?
You can get in contact with us. We're located at 2680 Main Street, Buffalo, New York, 14214, right across from the Amherst train station. And you can also contact us at 716-835-5439. We're here. We're open for business. We're ready. And even if you're looking for employment, if you have a high school diploma, if you want to get into working with children and you would like to go to school, we are also hiring, and I have resources to help you receive a CDA or also associate's degree in early childhood education free of charge.
What?
Latrice?
Yeah.
I asked, was there anything else?
Free.
Free.
Free. No student loans. Where was the program when I was younger?
Oh my goodness.
But absolutely.
Viewers, everyone that views this, please share. And even if you get down to that 28 minutes and 29 seconds, get there. I need them to share because this is important. If you're looking for daycare, if you are looking for employment, if you are looking for workforce development and being able to get a degree loan free, a CD loan free.
You heard?
If you have a heart and a passion for children and just nurturing them and being with them and learning some phenomenal leadership skills from Miss Latrice Martin, get in contact with her. 716-835-5439, Kidz Zone, 2680 Main Street. For our locals here in Buffalo, that is right across the street from Amherst Street train station at Main and Amherst.
And we're Kidz with two Z's, Kidz Zone.
Okay.
Yep. Kidz Zone.
Kidz Zone.
Yes.
All right. This has been a phenomenal conversation.
Yes.
And I must say, if you are not vaccinated, do your research, get vaccinated. If you have children, you don't know where your children are. Well, you do know where your children are because they're in school, but they're moving around the community. They're playing with their friends. Do your job as a parent. Get your child vaccinated. COVID has no name, no age, no size, it's unwritten. Do your part because God forbid, something happens to one of your family members and they could have been vaccinated and you could have helped prevent it. So do your job as a parent, as a community, as a sister, a brother, a mother, whoever you are, a cousin, do your job. Get your research, go get your child vaccinated, hold their hand, hug them, and take them for a milkshake afterwards because that's what I had to do. We went to Burger King and we got milkshakes after, but you won't regret it.
Yes. Thank you, Latrice, and thank you, Ebony, and our producer Angelina, for helping us out. And and if you need more information, please follow us on Facebook, or go to @Reach Buffalo, like us, share us, whatever. You all know the jargon, you know what to do. But certainly, once again, we want to thank our listeners, and thank you, Latrice, for sharing these jewels with us. This has truly been insightful and informative. Have a blessed day. Take care, everyone.
Reach Buffalo, promoting a healthy community. Reach, racial and ethnic approaches to community health locally in Buffalo to reduce racial and ethnic health disparities and rates of chronic disease. We want to make a change by reducing exposure to tobacco in housing and work areas, by increasing access to nutritious foods, by creating a breastfeeding community, by increasing referrals to primary care and community health providers, and by implementing community work groups. Reach Buffalo will concentrate on Ferry Street itself, as well as a community that resides within 4 blocks to the north and south of the corridor in 5 zip code areas: 14208, 14209, 14211, 14213, and 14215 in Buffalo, New York, with disparities in rates of chronic disease. Get involved. Ferry area residents will have an opportunity to have a platform to voice their opinions, organize, and make decisions in these efforts. For more information, you can contact Ebony M. White, Community Outreach Coordinator, at 716-268-2954.